Good morning, everyone, and welcome to this Thursday, December 16th, 2021, City of St. Louis Department of Health Joint Boards of Health and Hospitals meeting. It is great to see everyone, and I would officially like to call the meeting to order. And our first order of business is approving the Zoom video to serve as the meetings from our previous, the minutes from our previous meeting on November 18th, 2021. May I please have a motion to approve the Zoom video from November 2021 as our meetings from minutes for that meeting?
A move approval.
Thank you, Dr. Ross. And may I have a second, please?
Second.
Wonderful. Is everyone in agreement? Any opposed? Wonderful, so moved. And so we will move to Dr. Mahdi, who will give us the COVID-19 update.
Good morning, everyone. I hope everyone's doing well this morning.
Dr. Mahdi.
We'll take a little bit more time with the COVID update today because we have some concerning trends that I want to make sure everyone is comfortable with and give some time for questions. So I'll get right into it. So as usual, we've been keeping track of the COVID-19 cases by zip code. These are on your screen right now. The 63109 in the Southwest and 63101 downtown continue to have the highest rates. Case counts have been rising quickly since the start of November. Currently, there are 68 new cases per day on average. That's up from 41 cases per day 1 month ago on November 13, a concerning upwards trend. When we look at the epidemic curve that's in front of you now, the average daily case counts are the highest they've been since January 21st of this year. The recent Delta wave in the summer peaked at 62 cases a day. And like I just told you, we're currently at 68 cases per day. That's very concerning. This pattern is particularly troubling when you consider that the newly highly transmissible Omicron variant is not yet causing community transmission in our region, as far as we know. So as you know, I announced the first case of the Omicron variant in the state here in the city just over a week ago. And so I anticipate, given the way the transmissibility trends that I've been following in the first region to announce its spread, the Gauteng region, but also the incredibly high rate of community transmission that we're seeing globally at this time. So this graph shows the COVID-19 testing volume and results. The number of tests being performed each day has remained pretty consistent over the last 6 months, around 1,500 tests performed each day, about 1,200 of which are PCR tests. So this is a particularly important slide for you to pay attention to. This presents the COVID-19 percent positivity rate. And so similar to case counts, percent positivity has also been steadily increasing since the start of November, though it's begun to level off in recent days, fluctuating at around a rate of 8.2. This is just over double what it was a month ago, and this is still well above the target rate of 5%. And what this alludes to is increased levels of transmission and or not enough testing within the community. But now that I've been seeing this trend for over a month, I'm very confident that this reflects transmission more so than a testing issue. Not too much time spent on this. We look at case density by ward or neighborhood, and a few hotspots of transmission can be seen in Princeton Heights, Southampton, and Hollywood Hill neighborhoods. But the greatest clustering is happening in Dutchtown, which is Ward 16. When we look at case demographics by race, we know that African Americans have been disproportionately affected by COVID-19 throughout the course of this pandemic, shouldering just over 75% of the burden of infection. However, November cases had a more equitable distribution with a 50-50 split between Caucasians and African Americans. But December is trending back towards African Americans being more heavily affected. When we look at sex, there have been more females than males reported as COVID-19 positive throughout the course of this pandemic. Females tend to have greater healthcare seeking behavior and more likely to be tested. But the December data is preliminary and subject to change. We're just now getting that in. For age, I think the important things to note here are that children represent a much smaller proportion of new cases than they did in September, down to 20% of new cases from 31%. So that is a bright spot of news in what has been some difficult trends we've been seeing here. Ages 70 and above saw a decrease in relative proportion in November, but an increase in the first 2 weeks of December. So it'll be important to keep an eye on this vulnerable group. So when we look at COVID-19 cases and school-aged youth, so that's 5 to 17-year-olds, there were 57 new school-age diagnoses since the previous report. There's no clear geographic pattern, with the majority of zip codes having between 5 and 10 new cases. So these are spread out quite evenly. The number of PCR tests for pediatric ages peaked in September, but is held steady around 200 tests per day. Each five-year-old age group has had a similar number of tests performed, but adolescents aged 15 to 19 have had the most tests in 2021, which I wanted to note. So you haven't seen testing presented in the way. I've asked our epi team to include more data around testing, as especially in the winter months, and I will talk to you a little bit about why I think it's going to be important for us to look at that in addition to the other metrics that we've been following. So here we see the percent positivity 7-day average in the pediatric age group, and percent positivity across all age groups has risen over the last months. Ages 0 to 4 consistently have lower percent positivity than the other 3 age groups, but they have not had a rate above 10% since January of 2020. Compare that to ages 5 to 9 and 10 to 14, which have gotten above 20% during the Delta wave. So vaccination initiation in the pediatric population, currently 37.9% of eligible children have received at least 1 dose. The speed of childhood vaccines seem to have slowed down somewhat over the last week. Southwestern zip codes have had high rates of vaccination in children, whereas northern zip codes, particularly 63120 and 63115, have only had 16% of children vaccinated. It's critically important to make sure that this is equitable, so I'll be talking to you about my plans to address that shortly. I want to move now to our vaccine administration date. So vaccination initiation saw a large increase in November, with the 5 to 11 age group leading the way, but like I said, has recently seen a decline. The number of second doses saw a predictable bump after the appropriate 4 to 5 week delay as well. There was a noticeable dip in the number of doses administered, partially explained by the Thanksgiving holiday, which has rebounded somewhat since then. Boosters in particular, though, continue at a steadily increasing rate, which is reassuring. Vaccination initiation has really slowed down in December, and even among young children 5 to 11, the pace has slowed following a rapid start in November, as you can see the trends here on this graph. We've talked a little bit about geography, so I'm going to talk a little bit about neighborhood vaccination clinics. So this map indicates the location and number of doses administered at past neighborhood clinics. The circles are proportional to the number of doses administered. The bigger the circle, the more doses. So doses counts range from 4,000 to just under 3,000 administered. Data from 79 events held at 50 distinct locations, and dose counts for locations with multiple events are added into one total. The purple pins that you see indicate clinics in December of this year. So the most recent vaccination clinic at Kennerly Church administered 25 doses, but our school events have administered over between 320 and 380 doses, which is an incredible variation. And I'll speak a little bit as to where we see, how I monitor those numbers and what we'd like to see moving forward. So a little bit now, I wanted to also include some data about sewer shed surveillance. So recent sewer sewer shed surveillance shows that 100% of sequenced samples are Delta variant. No Omicron has been detected yet, except for our one case. And the reason that one case is not even reflected is because this was someone who was tested at a private lab outside of the city that we then identified as being within the city. So I wanted you to see the facilities with elevated viral load in wastewater. And this is data from 12/6, so that you understand where we get some of our data, especially around genomic sequencing, as we continue to look at the Omicron variant in the upcoming weeks. So again, the variants of concern, the B11529 Omicron variant. So this is a new variant, given the name Omicron, that was discovered in Botswana by a Zimbabwean scientist named Dr. Sikulele Moyo and his team based in Botswana on November 11th, and then South Africa on November 14th. Since then, it has spread to 65 countries, including in the US, 30 states have reported at least one case, and these are mostly travel related. So a little bit of education here. We're concerned about three main things here: how fast this transmits. And when we look at the relative speed that this is transmitted throughout the world in the same amount of time for other variants of concern, it has outpaced them. So there is definitely concern around its level of transmissibility, but we still don't have enough data to say conclusively if the other two areas that we're concerned of, which are whether it can impact severe disease and whether it can evade the immune system. The severe disease, we've got some preliminary data out of sub-Saharan Africa that shows a lot of people have started to kind of hinge on this, what I think is too early, that it causes mild disease. But you have to be considerate of the fact that this population in sub-Saharan Africa is significantly younger than that in the UK, the US, and other high-income countries. So again, we need to give time to accumulate data that's more generalizable. As far as its ability to evade the immune system, we know that Pfizer recently announced that boosted folks have good level of protection against Omicron. So my PIOs and communication teams have started to do communications around that and around other mitigation strategies that are proven to be effective in preventing the spread of COVID regardless of variant, which include vaccination, boostering, as I just mentioned, but masking, social distancing, hand washing, and other mitigation strategies. So you will see on our website, there's a very strong education push around this. All our social media outlets are doing this at least twice a week on my request. And I have been meeting with clusters of leadership yesterday with our FQHCs and school leaderships in the next 2 weeks with business leaders across the region to really talk about what's important, how to frame this messaging, where the health department stands, and plans I have to do zip code level clinics to address some of the decreased rates that we've seen in vaccination, and have gotten firm commitments from our FQHC leaders to increase vaccine events in partnership with the city from January through March, and more on that later. I will stop now and take any questions about any parts of that. And obviously I focused more on the data, but if there's associated questions on some of the responses that the health department is planning to address some of these concerns, now would be a good time to field those questions as well.
Dr. Maddie, that was a great data dump for us. I needed to see that, quite enlightening. There was somewhat of a disconnect in one slide. You showed the areas of vaccinations with bubbles according to the amount of dosing, the doses delivered. But in subsequent slides in South City, where there were a cluster of cases, there seemed to be fewer doses delivered.
So unfortunately, this data that I presented doesn't do a great job of you being able to see the continuum over time. So this reflects over a month, but then the data that you saw forthcoming was a little bit more reflective of what we've seen more recently. So we have had focused efforts in South City and North City. A lot of our FQHCs have focused their efforts there. Moving forward, Dr. Ross, what I've asked is that we provide them with zip code level data every week, and that will start next week, where all of the CEOs of our FQHCs will have zip code level data, and we will be meeting to discuss. I meet with them weekly, but had more of an emergency meeting to really discuss a coordinated approach that I'd like to see through the winter months. And what they'll be doing from a week to week is giving me, if you go to the website right now, Kim Vandenberg, who's on this call, should be credited with an incredible amount of work that has gone into uploading the current vaccines week to week. So on every given Monday, you will see the current schedule. So what I've asked of the FQHCs is they're going to get this really great slide set that must be credited to Matt Haslam in the health department, who's done a phenomenal job of shouldering the data and analyzing this data and making it accessible to everyone. They will be getting that on a week-to-week basis, and they can make commitments to either increase their ability to respond to clinics during the week. So I spoke to the FQHCs that do this Monday through Friday at their dedicated clinics, and then those like Affinia who have a lot more flexibility around responding to new vaccine clinics. And what they told me is as long as they get 5 to 7 days, they're willing to increase or come up with new clinics, which will allow us to do so. Matt has also told me that the vaccination clinic bubble slide that you referred to was only for DOH initiatives, which have been focused on the low vax areas. So that doesn't reflect all of the other efforts from our partners, which are much more extensive. Does that help, Dr.?
No, that's very good. I really appreciate that.
Okay. Other questions, comments, concerns?
Dr. Mehdi, again, great presentation. I think it might be helpful. I think I understand this, so I'm going to throw something out and have you confirm it. Given that we only have at least one confirmed Omicron case in the area, we may have more, and there's a lot of, tense nervousness about Omicron. But what we're really seeing in those charts is Delta.
Yes.
And the older version of COVID. And what we're really seeing is seasonality, much like what we saw last Christmas season, holiday season, and Thanksgiving. And it's nothing. It's something to be concerned about. It's when people get together and so on. And so that's what we're going to see for the next couple months, probably. And it's also the lack of vaccination and so on and so on. Am I correct?
Absolutely. So I have a four-pronged approach to the winter and also the surges that we're seeing. The first is around vaccinations. We know that we need to encourage people to get first doses. And my approach with the FQHCs particularly, but our healthcare partners, which we've been in conversations with BJC and SSM here, as well as our schools, mean that we need to really be encouraging education and communication around first and second dose where applicable, and boosters, particularly knowing that in an attempt to be proactive and not reactive, that will help if we see increased community transmission against Omicron. The second part of this is very clear, distinct, and consistent education around other mitigation strategies, as I listed earlier: hand washing, wearing masks, social distancing, but other things like staying home when not sick, and really having an education approach and understanding how people learn. So if you've seen the communications that have gone out through the health department, and again, engagement has gone up significantly over the last month as well. I'm asking our communication partners to give me reports about how we're doing in engagement. We're seeing a lot more people write to us, send us messages, tell us how they appreciate and what's been helpful around communications. And then Kim and Harold have been very proactive about that. So you're now seeing educational videos that talk about the science, but you're seeing us also talk about different aspects of it and really break down why it's important. We're also uplifting data when it's available. So the recent publication about masking at the state level from Dr. Enbal Shabam from SLU, for example, are things that we've put out. So a very concerted approach to discussing what you need to do for mitigation factors, but also why, and give it to you in mediums that are easily accessible. Small infographics that you can easily put in a pocket, take home, give you the information on one slide. Videos, if you're the sort of person who likes to learn through that medium. Text, pictures. So we've really sort of been intentional about how that's done. So that's vaccinations, other mitigation strategies. The third is testing. The testing that we do through the city health department is through a partnership with Affinia, but I have asked Matt to add to these slides, as you now see, state level, regional, and city data around testing. We are actually applying for a grant that is due today, and many thanks for Craig Schmidt for uplifting that effort. That will also provide us with test kits that we're going to be, again, using our zip code level data to send free test kits to antigen tests that are, you have to pay for at the moment and then get reimbursed through insurance after mid-June, but send those to marginalized communities so that they have test kits available at home. The last part of my four-pronged approach is ventilation. So I am convening a big webinar / town hall of sorts with a business leader in the first week of January. They're getting communications by tomorrow around the standards that need to be in place in businesses around ventilation, but also use it as a time to reaffirm our mask order because of confusion that you are well aware has been happening around the recent Cole County hearing. So I have made sure that on a week to, actually twice a week, there are communications around the fact that the mask orders still stand and the validity of that under our charter and legislative process that includes the Board of Aldermen. That sort of consistent education, communication, and then weekly targeting vaccine clinics in areas that are not getting them is something that I'd like to see throughout the winter months so that we can be proactive and not reactive to this approach. So I hope that helps to make that clear for everyone, but specifically in line with your comment, Dr. McBride. And I appreciate you reinforcing the fact that this is right now a Delta phenomenon. So I really wanted to get ahead of any Omicron panic, which is not valid at this time.
Thank you so much.
Thank you, Dr. Maddie. Any other questions from the board or from any guests or comments? Wonderful. Thank you for the presentation, Dr. Maddie. So Dr. Maddie, you're on again, the ARPA report.
It's been a while since I spoke to you, but this portion of the presentation is around the ARPA report. And if you would just give me 1 second, I want to be able to show you that now. So this is in response to some questions that Dr. Will Ross had at our last meeting. Dr. Ross, would you be willing to just give some preamble as to why you asked for an update on ARPA and what things were most important to you at the time, as I just get this part of the presentation uploaded here? Yeah, you're muted, Dr. Ross.
Sorry. Yeah, I was interested in the timing of the funds and the distribution of the funds when they would be received and any restrictions on appropriate use of the funds. I had other concerns, but I think those were the three foremost.
Yeah, so what you see in front of you is an ARPA timeline that I'll start by walking you through. So in March 11th of 2021, ARPA was signed into law for the purposes of delivering direct relief to the American people, rescuing the American economy, and starting to beat the virus. The definition of this is obviously much longer, and I have attachments that I can send to the board after this around what was given to local, to city governments, county and city jurisdictions around the country around this, the criteria, as well as the process that was undertaken by the mayor's office to allocate these funds that preceded my arrival. So on June 1st, 2021, the city received just over $249 million, which is the first half of its state and local fiscal recovery funds and part of that allocation. On July 1st, the budget went into effect that included just over $17 million in revenue replacement funds. And then you can see at the bottom here that on August 16th, an ordinance was signed into law that appropriated these funds into these two categories. So the ordinance spoke to the 71393 COVID-19 response, just over $5 million, housing relief and building a social safety net, re-envisioning public safety, economic relief and direct cash assistance, housing production and preservation, planning and administrative costs, and then other costs were built into that budget. When you look at the compliance overview, eligible uses are number 1, public health and negative economic impacts, number 2, premium pay, number 3, revenue loss in government services, number 4, water, sewer, and broadband infrastructure, and then the uniform guidance also included competitive procurement, reporting requirements, and auditing expectations. So for our particular section, the Department of Health, there was this first round of allocation amounted to just over $15.5 million. And these were outlined as you see here. I tried to keep this clear for you, and then I'll talk through the line items. And again, I started on October 18th of this year, so had to do some catch up and transition around where we were, and are now beginning to address these. And I'll talk to you a little bit about my plans since being here. So in regards to the canvassing and community outreach, there was $500,000 that were allocated. This was intended to increase vaccination rates, increase health service utilization for focused geographics and population. And what they were hoping to do there was look at the number of attempts to reach households as outputs, number of households contacted, city total and in each zip code, the number of households reached and the number of canvassers, as well as the zip codes or neighborhoods reached. So the RFP has been written to address this particular line item, and it was received on October 25th and was then reviewed by the PSA committee. And we are awaiting bids for that. The second line item is the community health workers. So here there was $1 million that were allocated. The intent here was to increase vaccination rates, increase rates to primary care access, increase utilization of mental health services, and increase rates of social services. The outputs that they were hoping to measure here included the numbers of individuals reached, the number of individuals who get connected to a medical home, number of individuals connected to primary care services, number of individuals provided assistance to enroll in Medicaid, number of individuals connected to mental health services and social support services. So the public health program representatives hired at the beginning of the there were some public health program representatives hired at the beginning of the pandemic. And when I received this budget, DOH was tasked with reviewing how to best utilize those positions in response to COVID-19. So I'll talk a little bit more about where I am here. I want to just give you the layout first. The behavioral health providers that's on your screen. So there was $5 million allocated, intended to increase utilization of mental health services, decrease officer-involved violent incidences, and increase closed or stalled homicide cases. Here, they were hoping to look at number of services provided, number of people served, and number of calls diverted from police response. So again, this was in process. When I came in, there was a contract that was already in existence until June 2022. And so the hope was that they would apply more funding by February and working to release an additional RFP to increase the scope of those behavioral health services that currently there is one contract with BHR. The community violence intervention programs, $5.5 million were allocated here. The intent here was to decrease violent crime rates in designated areas, recidivism rates for justice-involved persons, increase access to health and mental health services, and increase access to community support. So again, this is in process. We currently have 3 sites for cure violence that are overseen by Commissioner Echols. We are in process of evaluating cure and expect a report from those partners. Commissioner Echols has recently been in meetings to discuss the report for data that will come out of that, overseen by a partnership between a community, a data fellow in the mayor's office and our EPI division. And we're also assessing the expansion of this program and other violent prevention programs through existing partners. Youth-led programming was appropriated $1 million. The intent here was to increase awareness among youth about COVID, reduction in City of St. Louis crime rates, increased number of safe space events provided for City of St. Louis youth. Here, the St. Louis Mental Health Board has been submitted to the City Councilor's Office and will be and has been discussed at the ENA panel. We also work very closely with Serena Mohammed, Will Pinky, who have been helping with these efforts. And I have had meetings with IHN around their Relink program that specifically addresses youth-led programming. So those efforts are forthcoming. The mobile vaccine clinics, $1 million were appropriated here to increase COVID-19 vaccine rates and increase access points. Again, contract with Affinia Healthcare is in existence for a part of this, and then an RFP is out to look at purchasing our own mobile vaccine clinic to this effect, and a little bit more on that later. Vaccine education and marketing was allocated $500,000, obviously, to target educations around increased vaccination rates and increased access to healthcare services, as well as just targeted COVID education in general. So we have an interdepartmental agreement with STL-TV that has utilizes $300,000 of those, the rest of which go towards our community services overseen by the DOH PIOs. And then lastly, the COVID-19 incentive program was allocated $1.25 million, again, to increase vaccine rates. DOH has had purchased just over 7,000 gift cards and has provided, I should have gotten the most up-to-date number, but in excess of 1,000 gift cards directly to newly vaccinated individuals at our clinics. Those are first dose events. So the way this process has worked is that obviously there was these funds allocated I show you in July. The work that the brief overview that I've given you, and I can allow Commissioner Echols to speak a little bit more to this if there are additional questions, went on up until I arrived. And during my transition, there wasn't as much forward movement as you can imagine, because a lot of that was getting transition, seeing where we were, and also just my concern about really identifying where the health department was in regards to workforce capacity, because it's easy to allocate these funds and have these really great plans around how these will be utilized. But if there is no available staff to uplift these independently, it makes it difficult to move forward. I also personally believe that moving forward with RFPs and plans to hire people before you've really engaged in a proper strategic planning, implementation, and dissemination process for each of these plans is ill-advised and can get us into the sort of trouble where we don't utilize these funds to the best of our ability. So a lot of my time has also been spent with the people who have been working on these, the different entities and partnerships, really talking about where we need to be and which governmental agencies we should be partnering with. A lot of these, as you've seen, the behavioral and violence-related initiatives require interdepartmental collaborations with public safety, for example, in the mayor's office. So those conversations are ongoing. Moving forward, there is still a slew of, a big chunk of ARPA dollars that need to be allocated halfway during the year, as well as in June of next year. The health department is currently undertaking our own internal budget process. So the way that I'm approaching that is really going for what the ideal is for the upcoming year interdepartmentally, regardless of ARPA. What would I want for the full amount? And then the mayor's office has informed me that how they will approach this is to see how much we're able to get within our internal budget and then take that into the account, as well as the recommendations that the health department and other advisors that the mayor's office will be utilizing to allocate the remainder of the ARPA funds. So I will stop here, ask Commissioner Echols if he has anything he'd like to add at this time, and then go back to Dr. Ross first, since this was something you asked for particularly for questions, and open it up to everyone else. Dr. Echols, anything that stands out that you'd like to clarify or speak to?
I think the biggest concern that we have is making sure that the health department and other directors within the city government have an opportunity to provide their list of priorities. One of the challenges last year was that there was an external body that actually set the priorities for the ARPA funds. And so we want to make sure that the priorities that are set are those that have been identified by the agency that's doing the work, and that there's data to support and justify utilizing federal funds in such a manner. So that's really all I have to add.
Thank you. Any other questions?
Sorry, and to that effect, one of the exercises that I've been engaged in over the last month is meetings with my internal leadership, Commissioner Echols, and the heads of our bureaus, as well as the mayor's office, to really put together my ideal ARPA budget for what I have seen after my 6 weeks of transition as would be most appropriate. Things that I did not see either reflected or adequately reflected in the first ARPA items that would be more realistic for where we are currently in the pandemic. I submitted that to the mayor's office last week and will be having meetings with them starting this Friday to see what amendments can be made in the short term, what allocations can be added in the moderate term, and what needs to be addressed in the upcoming second cycle for the next fiscal year starting July 1st.
The only thing I would add, thanks for that report, is precisely what I wanted to understand. And so I'm speaking to other board members. Our role really is to ensure that the health department has the capacity to utilize those funds in the time period that they're allocated. Dr. Maddie certainly has addressed that, and that those funds would not replace existing health department funds. We know how that works, right? You get a grant, and then all of a sudden, the resources that you had are actually supplement. Now they're not supplemented; they're actually reduced because of the granting, because we received the grant. I want to make sure that doesn't happen. That there are no existing resources that are reduced. That this is all supplemental, and that we have the capacity. So I appreciate what you presented, Dr. Maddie.
Thank you, Dr. Ross. Any other questions or concerns around this, or things you would like me to bring back?
I have a question. None of these funds goes to the opioid epidemic. Are there other sources of new funding to address that issue?
This is the challenge with these types of allocations, is when things that we deem priorities, and which Commissioner Echols, prior to me being here, has always deemed a priority, is the opioid epidemic. So he had already initiated existing programs to directly deal with that, which I will allow him to speak to in a moment. But I couldn't agree with you more in that this needs to be addressed and not sort of folded in indiscriminate ways within the budget. Right now, the place that this is being addressed most easily has been within the violence prevention as well as the behavioral health. And I'll allow Dr. Echols to speak a little bit to what is existing and what he has been working on to date. And then we can talk a little bit about places we'd like to see moving forward. Dr. Echols?
So in the area of substance use disorder, there's a lot of low-hanging fruit in the city and in the region. One of those items is expansion of the EPIC program into the city of St. Louis. And so we've been working with the Fire EMS department in collaboration with the Behavioral Health Network to expand the EPIC program, which would give the city additional capacity to respond to non-fatal overdoses, and also peer-to-peer navigators who can connect individuals who have substance use disorder, connect them to treatment and other social support services that are available to individuals living in the region. We also have an opportunity with the CDC and NACHO, so we're having discussions with them for a project that they're going to be funding in the city of St. Louis, as well as another grant through SAMHSA that Craig Smith and I've been working on to expand other components of the EPIC program, particularly adding peer-to-peer coaches in our fire and EMS department, so that there's a more timely response to non-fatal overdose reports and calls that come into the 911 dispatch center.
I have a comment. There are other cities, I just wonder aloud here, there are other cities that are implementing a very effective and inexpensive program through which EMS can administer and start treatment at the scene of a non-fatal overdose. And Pittsburgh is the last one to join that trend. And in that way, even though EPIC is fantastic and very helpful, nothing gives us a better chance of recapturing patients that individuals who've had a non-fatal overdose that start treatment on the spot.
Thank you for that.
I'm sorry?
Oh, sorry, go ahead.
So I wonder if that's anything that could be brought up or discussed, or is that within the scope of what we might be able to suggest?
Yeah, so the that work is already, some of that work is already being done by the Fire EMS department. One of the challenges with other agencies similar to the health department is workforce capacity. So they have a lot of vacancies in that department as well, and so they're limited really based on the capacity of their workforce. And so it's, we're working with them to get as many supplemental resources as possible, because you know the process in the city can be very difficult, and there's a shortage of EMS workers not only locally but across the nation, and they're expecting that trend will worsen over time. So we really need to have a more comprehensive infrastructure network of providers that are coming together to work to address this issue.
One of the meetings that I just had, 2 days ago now, was with Dr. LJ Punch, who, as you know, oversees the T and has been doing extensive training around this very issue, but also they have a clinical component that addresses trauma-related care, trauma-informed care, and this very area around opioid abuse. And so we are in conversations around what that training will look like for not only the health department, but our partners, and would love to extend it to EMS and have some collaborative approaches there where applicable, so that in spite of some of the workforce capacity issues that Dr. Eccles is talking about, if there's opportunities to provide that type of training for on-the-spot administration, that can hopefully be moved forward. My hope is that will be reflected in the new year, because unfortunately, those conversations preceded this current budget cycle, but I wanted to get ahead of those early for the next year. If you have other suggestions or ways that you would like to see this implemented, please don't hesitate to email me or schedule some time to meet.
Thank you very much.
You're welcome.
All right.
Other questions about the ARPA dollars or programs there within?
All right. Thank you, everyone. Let's move on to our next agenda item. And that will be Dr. McBride discussing the Missouri Medicaid expansion update.
Thank you so much.
All right.
Can you hear me okay?
Yes.
Okay, great. I'm just going to take a few minutes to discuss an opportunity to help St. Louis citizens increase their access to care. And I'm going to try to share my screen here to show you a few slides. Can you all see that okay?
Yes.
Great. So, as you probably know, although I think not everybody knows, through a long and winding road, I'm a Beatles fan, Missouri expanded Medicaid finally. And I'm just going to take a couple seconds to just look over the overview of what happened. In 2020, we passed a voter-initiated referendum to expand Medicaid, became the 39th state, including DC. I was counted as a state, to add Medicaid expansion to the state's constitution. And just quickly, what it does is it expands Medicaid. Currently, we only cover aged, blind, disabled, pregnant women, and children. Certain eligibility thresholds, pretty narrow, especially for custodial parents. As you can see in the graph below, custodial parents are eligible only up to 21% of the federal poverty level, which currently is about $13,000 for an individual, which is really so it's quite low, and childless adults are not eligible. So what Medicaid expansion does is makes this available for childless adults who are not currently eligible, and custodial parents between 21% and 138% of poverty, and everybody else up to 138% of poverty. So that's the way to think about this. And from the state level, the federal government pays 90% of the costs, and the state only pays 10% of the cost. So it's a significant enhancement. So if you followed the politics of this, the legislature did not fund the expansion. The state did what it was supposed to do under the amendment, filed what was called state plan amendment, but the legislature refused to fund it. And then the governor withdrew the state plan amendment. That led to a lawsuit. The lower court said the amendment was unconstitutional. This led to a Supreme Court, it was filed in the Supreme Court in July. The expansion, the Supreme Court said unanimously that it should proceed. So that's my main message to people as of July 22nd, 2021, that we are under expansion. Some people still ask me, have we expanded Medicaid yet? Yes, we've expanded Medicaid. So now the state said they needed a couple months to start processing the applications. So technically they didn't start processing them until October 1st. And by the end of October, we had 14,275 enrollees with 14,000 pending. As of the beginning of this week, 23,000 enrollees. Now, how does that stack up versus what we thought we would get? And how does it look in St. Louis City and County? I put the numbers here on a table based on the report that came out as of the end of October. So you can see that the state originally projected by the end of the year that we would have 274,000 people enrolled. We're only at 14,000 right now, or we were at the end of October, which is only about 5% of that total. In the city, we've enrolled 881 people per the state's report, which is only 3% of what I projected of the 28,000 people that might enroll. Our center did a study where we projected how many people would enroll county by county across the whole state. You can get that on our website. And you can see in that county, they've done a better job of enrolling 1,560 people, but still less than 10% of the people who could enroll so far. Very quickly, we have launched what's called the Missouri Medicaid Enrollment Tracker. I'll put the link to this in the chat in a minute. And you can look at, for example, the county by county enrollment numbers. And we plan to be updating this in real time as this goes forward with the numbers like I just showed you. And you can look at various things like how many people are enrolled across the whole state and how many people are enrolled in what categories over time. And the main thing I wanted to leave you with, and I'd be happy to answer questions, is what needs to happen now, I think, are the three things on this slide. Awareness. Do people really know Medicaid's been expanded? I have a grant with Missouri Foundation for Health, their center does, and there's been some focus groups, and when they ask people who are potentially eligible, other people really don't know that Medicaid expansion actually happened. We're probably the only state that had that kind of back and forth that happened with the lawsuit and the fights around Medicaid expansion. So I think people are confused about that, especially people who are in the eligibility categories, and there hasn't been good messaging about that. The state has not done much messaging at all. There needs to be more outreach to groups that could be assisted by the expansion. I put a couple examples of outreach flyers on this slide. One in the lower left is done by Missouri Foundation for Health. The one in the upper right is done by my colleague, Sean Joe, aimed at African-American men. And he's pushing this through the group Home Grow St. Louis, which I think is great. And we've identified like 10,000 African-American men in the city and county who could be eligible for Medicaid expansion. And then I think the third thing that could be done is assistance to help people enroll. It's not always the easiest process to enroll in our Medicaid system. And there's, I could show you, I won't take the time to do it, but I could show you that most people, about over half people, enroll online. They're, to the state's credit, they're doing work to try to make the application process simpler, but they haven't finished that process yet. So a lot of people couldn't benefit from the assistance, but there are some resources online. Missouri Foundation for Health has a lot of resources through its Cover Missouri initiative coalition, and there are others working on this. I'm not the person who leads all these efforts, but these are three examples that I cite. So I encourage people to do this because, as you can tell, we're pretty slowly moving towards that target of 274,000, who I think actually could benefit from this. And that number in the city that could benefit from this. And I went through that pretty quick. I'm happy to cycle back and answer any questions that people might have.
Dr. McBride, do you know if they did any, I guess, testing of the messaging for those flyers? I noticed that the homegrown flyer did not have the word Medicaid in it, which I think is probably important, because I'm under the impression that if they haven't had experience with insurance, they don't really know the difference between Medicaid, private insurance, what you can get with it, that might be a point of confusion. But why I'm asking is, if we're looking at an opportunity for the health department, if we have the ability to do some message testing to figure out what resonates with people, and then to just amplify and connect with some of the existing messaging instead of doing our own separate campaign, that might be an approach to take.
I think that's a great comment, Serena. I appreciate that. And I'll take that message back to the group that's working on that. I don't know exactly if they did some testing on that. I do notice the point you're making now, and I didn't pick up on that. You know, we do have this kind of obtuse name for our Medicaid program, MoHealthNet, but probably only about 30 of us in the whole state know what that means. And it should be Medicaid. You're right. And so I can tell you that the Missouri Foundation for Health has paid for a communication firm to do the flyers like the one on the lower left. And I just pulled one of them down. There's many others that you can pull down and use in social media and put up in your offices and such. And you can tell, I think that's a pretty nice looking flyer, I think. So it's a good point. I'll pass it along. I think you're absolutely right. Go ahead.
I just want to be clear, though. I'm saying that I think that flyer might be a better approach because it doesn't say Medicaid. If there's confusion about what Medicaid is, then the homegrown flyer is really focused in on what you can get.
Good point. So yes, this is an interesting point. In Kentucky and now in Oklahoma, they are using different terms for Medicaid. In Kentucky, they use the term connect. And in Oklahoma, there's a lot of attention being paid now. We expanded Medicaid at the same time as Oklahoma. They have enrolled over 200,000 people, 200,000. We've enrolled 23,000. And they call their program Sooner Care. So you make a good point that sometimes using a different name for the program might actually help a little bit. Thank you for that point.
Thank you. Thank you for the presentation, Dr. McBride. It's a great update. And I'm going to just piggyback on something that Serena said. Based on brand recognition, actually getting Black men or Black families or other community members that were otherwise not eligible before the expansion. Have you thought about using a peer approach? Because there are, some Black men that have already probably signed up, and figure out what actually helped people sign up in the first round. And so you can kind of replicate what actually did work in the people that have already gone through the process, and to maybe use some kind of peer-based approach.
Again, I will take that back to the team that's working on that. I think that is a great idea. I think one of the things that's a challenge when I talked to Sean about this is he was saying, hey, has anybody reached out to especially young African-American men? And, as I tried to point out at the beginning, single males in general have not been eligible for Medicaid before Medicaid expansion. So, unless you're disabled and unless you're a custodial parent, so very few of them would be in that category. So, there aren't that many role models around to do that. There are some, but now there will be some. So you're right. As they enroll, it'd be nice to have those folks being the role models for others. I think it's a great point. But I think that's part of our challenge, when the MFH made a list of groups to target, that I sort of pointed out the single males were not on the list.
Thank you. Do we have any other comments or questions for Dr. McBride? All right, thank you.
Thanks so much.
All right.
I'll stop sharing my screen here.
Thank you. On to our committee reports. So we should have 3 committee reports: the Governance and Nominating, Academic Public Health Collaborations Committee, and the Health Communications Committee. So could we start with the Governance Committee, please?
Well, I guess Linda is not available, but looks like we are. Hello, can you hear me? Yeah.
Yes, we can hear you, Doctor.
Okay, looks like we are in process of looking for a new chairperson. Yeah, we're looking for a new chairperson, and I think what Linda is updating to us is that there are a few candidates, but I think Mohammed is the one that we are planning to have her fill in for Rhonda when she leaves to a different job from our states. So that's what we plan to do, but I think we need to update the mayor on that, on this process, and also we need to during the 3 months period that we are in the transitions. I think we were thinking that Dr. McBride can maybe fill in as an interim in the process while we're going through the process of validating Serena to be the chairperson next. But in the process, I think that's how this is what we are planning. But behind the scene, we have to do a few things to get the transitions going. So
yeah,
that's
thanks, Paul. And
that's
I just
Dr.
wanted to
Jeffrey
add.
or Linda has anything to
thanks, Paul. And I just wanted to add.
Sure, Linda.
Oh, okay. I
Maybe
would
there's
just
some
add.
technical difficulties.
Oh, okay. I would just add.
Sorry.
Sorry.
Okay, is that better? Can you hear me? Okay. Yeah, I just thank you, Paul, for that. Sorry, I had to step away. I just wanted to add that yes, we're so sorry, actually, to be losing Dr. Ballou.
Yes, we're so sorry, actually, to be losing Dr.
I have no idea why I'm having that echo. Maybe that has stopped. Dr. McBride will.
We can hear you fine, Linda.
Dr. McBride.
Okay, there's an echo on my end, so I'll just keep going. Dr. McBride will step in and serve as our vice chair, stepping up from his vice chair to the chair position after the January meeting. We'll commence a 60-day nominations period during which our bylaws require us to have a nominations period to consider additional chair candidates. Although I think we are very certain that we certainly would like to have Serena step into that role. We do have a call scheduled. Dr. Ballou and a couple of us have a call scheduled with the mayor's office to make sure that everything will work well with her. I also want to mention that at our January board meeting, we will welcome our 2 new board members coming aboard. Stephen Scott and Dr. Colleen McNicholas will join us. Dr. Maddie, I'd like to work with you and your team to schedule some orientation for our new board members so that we can acquaint them with all of the department's offices and facilities. I'd be happy, I know our committee would be happy to help in acquainting them with any governance features, our charter, our bylaws, et cetera, et cetera. So I'd like to ask you and your team to at least have the orientation for our new board members on your radar for January, if we could please do that.
Absolutely, Linda. If you or someone could just shoot me an email with what's required and what you'd like to see involved there, I can start to facilitate that process and any potential dates so we can also help with scheduling.
Absolutely. And apologies again for that stepping away and any technical difficulties. I know our time is precious here. So thank you very much.
Thank you. Any other comments or questions about the governance committee report? And I also have some information and some documents that can help with orienting the new board members, and Linda, I'll coordinate with you to pass that information on from previous board trainings.
Oh, thank you, Ronna. That would be really helpful.
Thank you. Yes.
Craig, do you have an update?
I do quickly. Did want to mention on the Medicaid expansion that Dr. Maddie had brought a number of us together with the Regional Health Commission and the work with Missouri Foundation for Health. And yes, Serena, that message with sharing about how this is shared, it's kind of difficult in the state because of Mo Health Net and Medicaid and all the baggage that goes along with some of that. But sharing the new information about the changing rules, about the barriers to cost and so forth. And then some of the motivators in terms of healthcare for individuals is so important. With regard to academic, some of the role currently is with St. Louis University. I wanted to assure Dr. Ballou that we have heard her in terms of what we're doing and moving forward with our workforce development and workforce development plan. And there will be some surveys and so forth and working with staff and our learning and training. But part of that will include and has included both in the city and St. Louis County, what's known as BARHI, the Bay Area Regional Health Inequities Initiative, for us to figure out internally, both in city and county, how we're doing moving forward with regard to racial equity and other equities as well. So that's been a major focus of what we're looking at, looking forward to the new year in terms of going forward with the many great institutions that we have academically. I feel like I've been in an academic health department this morning with regard to budgets and COVID and Medicaid expansion. So it's a great learning experience and looking forward to the new year.
Thank you, Craig. I have one comment just based on some discussions that we had. And I know COVID has derailed some of these things that, it would, in terms of the academic health department, I know that much of the activity is funded through a Missouri Foundation for Health award that was received by St. Louis University. But it would be nice to see some interaction with UMSL, and I know that, and some of the other, Harris Stowe and some of the other academic institutions, and I know that you collaborate heavily with WashU, but it would just be nice to see some of the other organizations that have young people, I want to say young people in training who might be interested in public health or public health practice to reach out to some of the other institutions in our community to also kind of bring them into the fold in terms of the health department working with academic institutions. So hopefully come up in the future. I know it's been hard to do that because of COVID and things, but it would be nice to have that happen. I know that we have what might facilitate that is for our next round of board members, because there are some other seats coming open in I think later in 2022 and 2023, there were some candidates from UMSL and some other institutions that might benefit from collaboration or deeper collaboration with the health department.
Yes, leadership is very interested in that. Thank you. Yes.
If I could make one quick comment that I didn't mention before, but I thought of it while Craig was talking. I just wanted to put it in front of the board. As you know, we have a program called Gateway to Better Health in the St. Louis area, which I think helps maybe 20,000 people get access to care. That group is being transitioned into Medicaid coverage. It's going very slowly, as I understand. It probably should happen immediately, but I understand that transition will happen, and there will be transition to Medicaid coverage. So I just sort of wanted to remind you that's that's one of the groups that will be affected by this positively in the long run, but should have happened like overnight, in my opinion. But anyways, keep that in mind. That's pretty significant and important constituency in the area.
Thank you. Let's move to the next committee report, the Health Communication Committee. Lisa, do you have any updates?
We've continued to work on getting responses to our citizen community survey which measures awareness of our department and all we're doing, and also asks citizens to give their preference on which issues are most important for the staff and our board team and other allies to communicate about with more information and more access, as we've been talking about in this meeting. We've had the great work and help of Alderwoman Christina Gracia to do outreach to alders in codes where we have not yet had 25 responses, which include about 6 or 7 zip codes. And she has continued with us on a weekly basis as Matt Haslam and Kim and Harold have tabulated by zip how many responses we have to date. So we've been writing her. Additionally, if you live in the city and you paid your property tax or will, we have sent out a flyer to everybody with receipt, giving the QR code and the link to the survey, which will be in process through the middle of January. So we won't have the final results of the survey until January, but we have talked about getting a preliminary tabulation now because we know that probably the shape of the data is enough there with 645 responses across the city at this point. Anyway, we'll be back to you with the partially digested key findings. And it was suggested by our communications partner, St. Louis TV, STL TV, that we also give a short digestible overview report ultimately to the Board of Aldermen, whoever that is from the staff, maybe Dr. Motti, Commissioner Eccles, someone to let them know and thank them for doing outreach to their voters, their constituents, to get participation in our survey. This will give us greater awareness and engagement and help us with our outreach that we want to do to build, a healthy city. So thanks to everyone who's been working on that. And that's our update. We haven't had a committee meeting. We will after we get the tabulation of the results.
Thank you. Any questions for the Communications Committee?
Excuse me.
All right, thank you. All right. Our next agenda item, Dr. Motti, do we have any departmental updates?
An attempt to be brief because of time and because I'm sure you all have heard a little too much from me today. I will do some highlights from all the departments. I will say there's a lot of departmental updates because all the departments are thriving and doing amazing work. So I just want to shout out the leaders who are represented here. I see Candace De Silva, Craig Schmidt, as you know, Franda Thomas, and so many of the other leaders here who continue to do amazing work. So from communications, we're going to have a St. Louis American vaccination ad for the next 3 weeks. So again, some innovative ways to try and get those out. Our roll up your sleeve radio and digital ads will continue. Spots are featured. Dr. Eccles does weekly events here where he does a lot of communications around topics of significance, and we have a slew of others. 13 billboards around the city. We've got a COVID-19 health and safety tips holiday message featuring our commissioner. And again, Kim has spent a lot of time, and I would love for people to take some time to visit our website where she has updated all of the reports within the division, weekly clinic schedules, really incredibly done infographics to help with education events. So please visit the website there for more. And like I said, around testing, vaccinations and boosters, ventilation practices, and then other health measures. For our communicable disease, one of the things we're very proud of is the, and this was done under Commissioner Eccles' leadership, and Franda Thomas and her team, is the CARS project. 3 abstracts were submitted and all of them were accepted to present at the upcoming National African American MSM Leadership Conference on Health Disparities and Social Justice. The Fast Track Cities initiative, so congratulations there to all 3 of the folks, Preeti and staff from the Williams Associates. Dr. Eccles will be joining them as well for that conference. Fast Track Cities celebrated our 3rd anniversary on December 1st, a really beautiful event that acknowledged individuals or agencies whose efforts have been essential to the progress we've made thus far and the journeys ahead. For women, children, and adolescent health, there's brainstorming on best ways to survey their target population on maternal health issues ongoing. The LEAD program is gearing up for its first SLPS screening clinic at Patrick Henry Elementary School on December 15th. We are, our regional program coordinator is developing an interdepartmental agreement with the Department of Public Utilities and Communication for Wise Woman Transit ads. And our next Men's Health series on stress management is slated to take place in January. As far as disease investigation, I gave you some updates on COVID-19. I did not mention the fact that we're at 634 deaths, which is sobering and that we should keep up front and center. And we recently met with school leadership to provide when I first came in, I had a lot of feedback around our quarantine guidance from the city and a request to really review test to stay and test to return for our schools. We wanted to do so with equity front and center in thinking about how families can be supported whilst making sure this wasn't an increased risk. And we have provided them with a draft document that if they choose to participate in, will roll out in schools in the city in January. This will be really great as an additional option for families and schools, as well as standardizing the approaches through the counties and the city as well, which can often be really challenging for them to address. And I met with the CDC and 2 pediatric experts who have looked at the implementation of this in Chicago and other major cities, just to make sure that, you know, data in a pandemic is always not going to be a slam dunk. So we want to make sure that we have sufficient data to support how to best implement this without increasing risk to our children and our teachers. For our environmental health services, we have upcoming clinics on Saturday at Samaritan Church Clinic and O'Fallon Recreation Center on the 18th. Our emergency preparedness team is building capacity and planning to conduct a DOH lead pediatric COVID vaccination clinic in mid to late January. And PPE distribution and Clergy Coalition kit distribution is still underway. We've made significant strides in filling vacancies that I told you about at the beginning of the year. Many thanks to the leadership for being timely. And I've been meeting with our Department of Personnel at the city bi-weekly to make sure that we're really thinking about how we can address this critical issue. And they have told me that they are really impressed with the health department's response and willingness to engage with them to move this forward. So that has been really, really encouraging. I'll stop now in the interest of time, but take any questions.
I have a quick question, Dr. Mahdi. Are there, do the different departments or divisions in the health department, do they have like an email update or mini newsletter or anything that could be distributed?
It's so funny. I brought this up at our executive team leadership meeting yesterday. I think I've been very wary, Dr. Ballou, about initiating too many strategies when there's been such a big transition in leadership with me, when we have staff capacity issues as it is. And because we're at a very critical time of year where there's a lot of deliverables on their plate, including getting ready for our upcoming budget cycle. But Kim and Harold have kind of taken the lead in making sure that our website is a one-stop shop for a lot of these updates. And so if you go there, Kim has made it really as easy as she can within the limited infrastructure she's been given for that website to be able to see exactly what's happening across those bureaus. And one of the biggest updates is her updating all of the reports across the board. So you can easily go and see what's happening in each of the bureaus and subdivisions at the website right now. Those are all up-to-date reports. But I really take that on as great feedback. I think it would be great to have newsletters of sorts. I have my own very boring sort of mini newsletters that I provide the Board of Aldermen with on a week-to-week basis, but something monthly with graphics that's a little bit consuming. You know, Alderwoman Pam Boyd does an amazing job of this with her ward where she has her own newsletter. And we can definitely look into something like that that's a little bit more easy to access, because I definitely understand that sometimes wading through websites can be difficult to do, but also not accessible to our most marginalized populations, and something that we can also send directly to people's doors who don't have access in the way that we all know people don't with internet and other technologies. So I think that's a fantastic idea.
Well, thank you. And I mentioned that for two reasons. First, the latter reason you just mentioned in terms of access to a greater part of the community, and also I think that sometimes the board may find out about things that we could have been helpful with a little bit later. Sometimes the board members have skills that might be helpful in any moment to department initiatives. And if we had this kind of a little blip about what was going on and there are opportunities to volunteer or to contribute, it would just kind of help us to be more useful.
I really like that idea. And again, because my staff are currently doing the job of
obviously doesn't have to be done now, but at some point just to.
No, I actually think how I'm thinking about this is we have some open vacancies, Dr. Ballou, and I think a vacancy that's consistent with someone who can help around uplifting those types of efforts and other efforts to help with the organizational infrastructure I'm trying to build to streamline our efforts would be a fantastic place for this to reside. You know, so that and in collaboration with our communications department. So I'm just excited because my head's already swimming about what this could look like and how it would be nice for people to get a DOH, you know, really nice, colorful newsletter in their mailbox that hopefully doesn't go with the spam and the trash, but that some people would actually read and put up. So we can discuss that more, and maybe Lisa, when the communications department and I, you know, once we get through the survey, we can discuss how we can uplift that kind of effort moving forward.
Thank you.
Good idea. I wrote it down. Get back to you on that.
We're all over it.
We actually have a good template that was created before. So it's Arch Mental Health was the health department's previous newsletter. So that template, we can, Carol and Kim were really instrumental in developing that. So they can send that to you all so you don't have to start from scratch.
Great. Thank you, Dr. Echols. And thank you, Dr. Mahdi.
And Dr. Ballou, if I can take one little privilege, I would love if at future board meetings, people came with great things they've seen coming out of the health department and feedback and ideas that they have, just like the ones that you had. And if we don't have time, please feel free to email me those things. I'd love to hear more diverse feedback about what people think we're doing right and what they may not be seeing, so that even if we are doing it, I can be attentive to how we can make sure that's more visible and available. So if folks could really be thoughtful about that for future board meetings, I'd appreciate it.
Great. And I guess I would suggest that just becomes part of the discourse for the departmental updates. All right, thank you. Do we have any old business?
Could I make a quick comment about that discussion we were just having? And I don't know if it falls under old business. I want to connect a couple dots back to the ARPA discussion we were having that Dr. Ross brought up and Dr. Mahdi responded. as I was looking at those numbers and thinking about it, it creates a great opportunity because you can do some quick one-time hiring and all that. And the challenge will be making that sustainable in the long run. And, we all know that we're going through a pandemic now, and we want to come out of it with sustainable public health efforts consistent with the comment that was just made. Maybe there's a role that the board could help the department with is thinking about being strategic about that spending, and so that we can the department can spend it in such a way that when it's used up, there'll be some programs and people and such left that can sustain, improve public health in the city in the long run, and that advances the strategic plan.
Thank you, Dr. McBride. All right, so we will move on to announcements. Do we have any announcements?
Yes, I have an announcement, and we should be proud of our own Dr. Keon Gilbert, who was recently named a Rubenstein Fellow at the Brookings Institute. A very, very prestigious appointment, fellowship, and he'll be focusing on governance over the next 2 years. So congratulations to Dr. Gilbert.
I'm actually going to pop his Brookings information in the chat, because that is an incredibly big deal, and we are super proud of him. So yeah, he's actually starting to work on issues related to policy for health insurance and payers and things like that. So he'll come back with some great information. So you could see his governance studies profile in the chat that I just popped in there. So thank you, Dr. Ross, for bringing that up, because that is definitely something to be proud of. The only other announcement that I have is that the next meeting will be on January 20th, 2022, in the new year, same time, same place on Zoom. Any other announcements? All right, I would like to move that we adjourn with 3 minutes to spare. May I have a motion to adjourn, please?
So moved.
Thank you. A second?
Second.
All right, so we are adjourned. Everyone stay safe. And
Happy holidays.
happy holidays.
Happy holidays.
Happy holidays.
Right.
Bye, everybody.
Happy holidays, everybody. Bye-bye.
Be healthy.